Good day, everyone. My name is Nika Babes Potalinghog, a first-year nursing student from Davao Doctors College. And today, I will be demonstrating how proper parenteral administration of medication and preparation of medication from a vial is done through the subcutaneous and intramuscular way of medication. The first thing to do is to check the doctor's order on the patient's medication administration record. This is to identify what kind of drug is to be given to the assigned patient, to identify the drug's name, its dosage, the route of administration, and the time it is to be given to the patient. After that, perform hand hygiene to eliminate or to prevent the spread of microorganisms and avoid cross-contamination. Then we will not forget to don gloves into our hands.
Careful. Pwede ako yung gloves, no?
After donning our gloves, we're going to organize our equipment. Now, the equipment that we will be using are, we have here the syringe. We have two syringes. One is used for our subcutaneous way of medication, and the other one is used for our intramuscular medication. We also have an extra syringe. This will be used for the actual administration of our medication. Then we have our sterile water in the vial. This will serve as our medication for today's demonstration. We also have our waste receptacle. This is where we dispose all of the used needle to avoid the pricking of our finger. We also have here two kinds or two sorts of cotton balls. The first one is soaked in 70% of alcohol. Then the other one is just plain cotton ball, which is dry. We also have here our hypodermic tray, wherein we will put all of our already prepared syringes to be administered to the patient when we bring it to the patient's room. After organizing the equipment, we're going to prepare the medication vial for drug withdrawal. Let us first grab our vial, check the label if it's the correct medication, and then we're going to clean the rubber cap with an antiseptic wipe by rubbing it in a circular motion for 30 seconds using a soaked cotton ball to a 70% alcohol, like so. After that, we're going to dispose our cotton ball, place it on the side, and then we're going to withdraw the actual medication. Let us first grab our syringe, open the package. Then we're going to only touch the plunger and the barrel. Now, since this syringe already has a needle, this will serve as our aspirating needle in withdrawing the medication. Now, let us uncap the syringe, and then we're going to withdraw some air, making sure that it's equal to the medication needed or requested by the doctor. Now, since the doctor requested 2 milliliters, we're going to withdraw it here in the syringe. Okay. After that, we're going to position our syringe in a 45-degree angle, making sure that the bevel is facing upwards. And then poke it into the rubber cap, like so. And then depress the air into the vial. And then tilt or invert the vial, and then we're going to withdraw medication up to the same amount or the same amount of the air that was withdrawn. Okay, for that, We're going to grab the cap and then recap it back. And we're going to change our needle with the needle that we will be using to the actual administration of the medication. We will grab our needle, which is gauge 23, then open it, grab the syringe, uncap or twist the syringe from the needle, and then retwist it on this. After that, we're going to place it into our hypodermic tray, throwing all of the waste to our waste receptacle. Then we're going to write our medication ticket, making sure that we are writing the name of the medication, the name of the patient receiving the medication, the dosage, and the time it will be administered. And then after that, we're going to place it along with our syringe. Next is we're going to do the same thing on our other syringe for our subcutaneous medication. We're going to grab our syringe, open the syringe, only touching the barrel and the plunger, uncap the needle. We're going to withdraw the same amount of air through the physician's requested medication. And then we're going to grab our vial, position our needle to 45-degree angle, and then poke to the rubber, and then depress the air to the vial, invert the vial, and then withdraw the medication. After that, we're going to recap our syringe and then place it into our hypodermic tray. Again, writing the medication ticket on the name of the medication, the name of the patient receiving the medication, the dosage, and the time to be administered. Then we're going to place it along with our syringe to the hypodermic tray. Then we're going to dispose our wrapper to our waste receptacle. After the preparation, we are going to proceed with the administration of the medication, starting with the subcutaneous administration. Prior to the conduct of the procedure, we must first ensure to perform hand hygiene to prevent the spread of microorganisms and observe appropriate infection prevention procedures such as donning of the gloves and at the same time providing our patient with privacy. After donning the gloves, we are going to proceed by introducing ourselves to the patient, identifying the patient's identity, and explain to the patient what the procedure and medication is all about. Okay, ma'am, good day. My name is Nika. I will be your student nurse for today. Can I please see your wristband, ma'am? Can you please state your name and your birth date?
March 7, 2004.
Okay, thank you, ma'am. So today, ma'am, I will be injecting insulin as per requested by your attending physician, Dr. John, since you have a type 1 diabetes. So this will help you in controlling your blood sugar level. Would that be fine with you, ma'am?
Yes.
Okay. After that, we must assist the patient to a position in which the arm, the leg, or abdomen can be relaxed depending on the site to be used. Ma'am, are you comfortable in that position? Okay. Now we're going to determine which site will be used and expose the potential injection site. Since in this particular case, we are going to inject the medication to the patient's abdomen, we are going to inspect the area for any bruising, inflammation, or edema. Okay, ma'am, I'm going to open this part of your shirt. Is that fine? Okay, so there are no signs of edema. Okay. Now, we are going to use an antiseptic swab or a cotton ball soaked in alcohol to clean the site starting at the center, circling outwards. Then we're going to dispose the used cotton ball. After that, we are going to get our syringe with the medication, remove the cap, and hold between the thumbs and index finger of our dominant hand as if we are holding a dart, like so. Then, insert the needle quickly and firmly at a 45 to 90 degree angle. And also, we must remember that as we must insert it without hesitation, as this will lessen the pain a patient can feel as we administer the medication. Then we're going to release the pinched skin and rest the non-dominant hand on the patient and move the dominant hand on the end of the plunger and slowly inject the medication over several seconds while retaining the grasp on the syringe to keep it still. Okay, ma'am, I'm going to insert. Now, quickly withdraw the needle and place a swab or gauze on the side and apply gentle pressure, making sure you're not massaging the area. Okay. After administering the medication, make sure to dispose the supplies appropriately to avoid accidents and flip down medication ticket. Then, we're going to place the patient in a comfortable position. Okay, ma'am, are you comfortable in that position?
Yeah.
Thank you. Now, let us document the procedure and all relevant information, assess the effectiveness of the medication, and the patient's reaction to the medication. So, ma'am, so far, how are you feeling?
Fine.
Okay. After the subcutaneous administration, we are going to proceed to the intramuscular administration. After donning the gloves, we are going to proceed by introducing ourselves to the patient, identify the patient's identity, and explain to the patient what the procedure and medication is all about. Okay. Good day, ma'am. My name is Nika Babes. I will be your student nurse for today. Can I please see your wristband, ma'am? Can you please state your name and your birth date?
Ematina Torgo, March 7, 2004.
Okay, thank you. So, ma'am, today I will be injecting penicillin G to you since your attending physician, Dr. John, has requested for it to help kill or treat the bacterial infection on your body, ma'am. Will that be fine with you?
Yes.
Okay. So, as you take this medication, ma'am, you will feel few side effects such as nausea, vomiting, or even diarrhea. But if you do feel anything that is quite discomfort to you, you can inform me right away, ma'am. Okay? Okay. After that, we're going to assist the client to a supine, lateral, prone, or sitting position depending on the chosen site. So since the chosen site is the deltoid muscle, therefore I will assist the client into a sitting position. Okay, ma'am, I'm going to put you in a sitting position. Can you help me carry yourself?
Yes.
Okay. For a while, ma'am. Okay, are you comfortable in that position?
Yes.
Okay. Then we're going to examine the integrity and amount of the patient's muscle mass and palpate the muscle area. Inspect the area for bruising, inflammation, or even edema. If the skin shows bruises or inflammation and tenderness, then this site might not be suitable to be an injection site. Okay, ma'am, I'm going to roll your sleeves. Now, we are going to use an antiseptic swab or a cotton ball soaked in alcohol to clean the site, starting at the center, circling outwards. Then dispose the used cotton ball. After that, we're going to get our syringe with the medication, remove the cap, and hold it between the thumb and index finger of our dominant hand as if we are holding a dart. Then, we're going to inject the medication using the Z-track technique. Place our ulnar side of our non-dominant hand just below the injection site and hold the patient's skin laterally about 1 to 1.5 inches and hold the position until we insert the needle. Then insert the needle quickly and smoothly at a 90-degree angle, and as we insert, we must insert it without hesitation as this will lessen the pain the patient feels as we administer. Now I'm going to insert. Now, quickly withdraw the needle and place a swab or a gauze on the side. Apply gentle pressure and do not massage the area. After administering the medication, make sure to dispose the supplies appropriately to avoid accidents and flip down medication ticket. Then we're going to place the patient in a comfortable position and discard our gloves and perform hand hygiene. Okay, ma'am? I'm going to put you back in bed. Can you help yourself, ma'am? Okay, slowly. Are you comfortable in that position, ma'am? Okay. Now, let us document the procedure and all relevant information, assess the effectiveness of the medication, and the patient's reaction to the medication. So, ma'am, so far, how are you feeling?
Good.
Okay. Do you feel anything unusual? Okay. And that is how we properly administer parenteral medication through subcutaneous and intramuscular administration.